Can ibuprofen increase the risk of a heart attack and other heart problems? Ibuprofen is a common over-the-counter medication, but does have serious and even deadly side effects when taken for a long time. Coming up. What is ibuprofen? Ibuprofen, the brand name is Advil or Motrin, belongs to a class of drugs that we know as non-steroidal anti-inflammatory drugs, or NSAIDs for short. How does ibuprofen work? Ibuprofen helps with pain relief by blocking the production of prostaglandins. Prostaglandins are made at sites of tissue damage or infection that are involved in dealing with illness or injury. They are made as the body's response to injury. What are examples of other NSAIDs? Some common over-the-counter NSAIDs include ibuprofen, aspirin, naproxen, and some prescription NSAIDs include etodolac, indomethacin, naproxen, diclofenac. What is the most serious side effect? If ibuprofen is taken regularly and for a long time or at high doses, there's an increased risk of fatal heart attack or stroke or heart disease such as congestive heart failure. Please do not use NSAIDs before or after heart bypass surgery. Moreover, ibuprofen can cause fatal stomach or intestinal bleeding. This can happen all of a sudden and is especially worrisome in older adults. If you're interested in what might happen if you're on too many medications, hit the link above. What are other side effects of ibuprofen? This is not a complete list. However, some common ones to know or be aware of are vision changes, shortness of breath, swelling in your face, tongue, hands or feet, a rapid weight gain, skin rash that is red or purple with blisters, bloody or tarry stools, coughing up blood or vomit that looks like coffee grounds, GI side effects such as nausea, upper stomach pain, itching, little or no urinating, dark urine, yellow or skin or eyes which are yellow. This is called jaundice, a rapid heart rate. If you're finding value in this video, don't forget to like, share and subscribe. There are too many side effects to remember, so what do I need to ask my doctor before I take ibuprofen? So if you have heart disease such as congestive heart failure, coronary heart disease, or had a stroke, talk to your doctor if it is safe to take an NSAID. I will emphasize again, NSAIDs can increase the risk of heart attack, heart failure and stroke. However, if you're on low dose aspirin, this is cardioprotective and you should take it as directed by your prescriber. If you have stomach gastritis, stomach ulcers, even a history of bleeding in your GI tract, talk to your doctor whether it is safe to take an NSAID, such as ibuprofen. If you have liver cirrhosis or heart failure or kidney disease, you should avoid taking NSAIDs as this medication can exacerbate these diseases. Talk to your doctor if you have high blood pressure and you want to take an NSAID as they can raise your blood pressure. There are certain disorders that can increase bleeding, such as hemophilia. So talk to your doctor or your provider if it is safe to take an NSAID. Usually, if you're scheduled to have surgery, NSAIDs are stopped several days to a week before surgery. If you are on other medications which can increase the risk of bleeding, such as aspirin or Coumadin, talk to your provider to see if it is safe to take an NSAID such as ibuprofen. Avoid NSAIDs during the last 3 months of pregnancy. It increases the chance of a premature closure of a fatal vessel. Also, early in the pregnancy, it increases the chance of miscarriage and malformations. So when do I have to immediately stop taking an NSAID such as ibuprofen? If you have any signs of an allergic reaction such as swelling of the face, lips, tongue, throat, wheezing, you have trouble weaving or hives. If you have any signs of a heart attack or stroke, such as chest pain radiating to your jaw or shoulders or your arms, if you have signs of a stroke like sudden numbness or weakness on one side of the body, and you have impaired speech or slurred speech, leg swelling. If you have sudden shortness of breath in someone, especially with underlying asthma. If you have acute swelling or rapid weight gain. Signs of stomach bleeding, bloody or tarry stools, coughing up blood or vomiting that looks like coffee grounds. Signs of liver problems such as nausea, upper stomach pain, itching, tired feeling, fatigue, flu-like symptoms, loss of appetite, dark colored urine or clay colored stools, jaundice. Signs of kidney problems like little or no urination, painful or difficult urination, swelling in your feet or ankles, feeling tired or short of breath. And signs of a low red blood cell count, such as you're pale or feeling lightheaded, short of breath, a rapid heart rate, trouble concentrating. There are some severe, potentially life-threatening skin reactions. One of them is called toxic epidermal necrolysis, and another one, Stevens-Johnson syndrome. These are rare, but can present with red or purple skin rash that spreads, causing blistering and peeling. And if you hit the link above, this explores the side effects of another common over-the-counter medication called Benadryl. So how should I take ibuprofen and at what dose? The maximum amount of ibuprofen for an adult is 800 milligrams per dose, or around 3,200 milligrams per day. This is about 4 doses. Use only the smallest amount of ibuprofen needed to get relief from your pain, swelling, or fever. I recommend to take ibuprofen with some food to lessen the stomach pain, the stomach upset. Can older adults take ibuprofen or any other NSAID? I think it is important to consider non-pharmacological approaches such as weight reduction, stretching, increased physical activity, and therapy to help these patients who are experiencing musculoskeletal pain. In fact, in my practice, the next step would be to use Tylenol as needed or scheduled to help with symptom relief or symptom management. NSAIDs are very rarely used. If a patient still requires an NSAID, GI prophylaxis should be considered in older patients, especially those with other risk factors. So what I use in my practice is something like what we refer to as a protein pump inhibitor, like Omeprazole or pantoprazole, to help protect the stomach. Then the NSAID should be started at the lowest effective dose for the shortest period of time. I rarely use it for more than 5 days, especially in older adults. One of the rarer side effects, just for you guys to know, NSAIDs can also increase potassium, especially in older adults, especially if they're diabetics or have kidney disease. Question of the day: are you on an NSAID such as ibuprofen, and have you had any side effects? If you have had side effects, please list them in the description below. If you want to see more videos, don't forget to subscribe, like, and comment, and you can click right here, or click right here, click right here, or click right here. Oh, do it again. Oh my god, this video took so long. I think I'll take an NSAID. It'll help with my headache.